And I'm gonna move the camera while she does that. Okay, perfect. So I'm gonna have you face that way for me.
Mm-hmm.
May I palpate your back?
Yes.
Okay. So I'm looking at her spine right now. It is in the middle of her back, and it is straight. There's no curvatures or anything like that. So now I'm going to put my hands right here. I'm just going to have you take a deep breath. Okay, my hands did flow outward, so there's about a 1-inch gap right there. So now I'm going to listen to your lungs and stuff like that. Oh, my stethoscope's caught. Okay, so I'm just gonna have you breathe in through your nose and out through your mouth every time I move the stethoscope and stuff like that.
Okay.
Oops. Go ahead. Okay, breathing was bilateral. It was even. I didn't hear any crackles or wheezing, so that's a good sign. So now I'm gonna do the same thing on your front side, if that's okay with you.
Mm-hmm.
Okay. I'll just go under. Okay, and then okay, again, sounds were even bilateral, no wheezing or crackling again, so that's a good sign. I'm gonna have you lay down on your back now.
Mm-hmm.
I'm gonna move the camera again. Okay, I am going to drape you. Hang on. Sorry. So we're gonna put one right here, one right here. I don't want it to get in your mouth. There you go.
Mm-hmm.
Hang on, I might need to. Okay, that should be good. Okay, so I'm gonna look at all 4 quadrants. They do look symmetrically the same color, a pale tan color. No lesions or anything that I see. Her umbilical is inverted with no drainage that I see. I'm looking at her contour and it is flat. There's no bumps or raises or anything like that. And so, do you have any pain or tenderness in there?
No.
Okay. So I'm just gonna listen to your bowel sounds. Okay, so I did listen for bowel sounds, and I did find about 7 bowel movements when I was listening, which is completely normal. The normal range is 6 to 30 bowel movements, so she's a little bit on the lower end, but that is okay. And then I'm going to palpate your abdomen. Okay, any pain or tenderness when I touch any part of that?
Nope.
Okay, so I did notice that it was tender and the same throughout. There was no pain. She didn't flinch or anything like that. So abdomen checks out. I'm gonna have you sit up for me if you could.
Mm-hmm.
Okay, and I'm gonna have you face the same way. Just that way.
Oh, okay.
Can you scoot up that way a little bit? Thank you. Have you ever had any issues with your kidneys?
No.
Okay, so I'm going to. Any pain or tenderness?
Nope.
Okay. Any pain or tenderness?
Nope.
Okay. So, overall, that would end the procedure. I would make sure that the patient is comfortable. The call light and items are that in reach for her. She has a safe environment. I would make sure that the bed is in the lowest position. The bed rails are up 2 times, and then I would make sure that I would document my findings and stuff like that. So that is all.